So we are nearing the end of the day for the sessions. We all are delighted to welcome our renowned and respected Dr. M. Niraimathi ma'am to share an innovative and challenging topic today. We also welcome chairpersons for the session, respected Dr. Tilagavati ma'am, Vice Principal, HOD and Professor of Department of Microbiology, a powerful MU coordinator, Government Thiruvannamalai Medical College and Hospital, and Dr. Adi Kesavan, sir, HOD and Professor, Department of Physiology, Government Vellore Medical College and Hospital, to introduce the speaker.
Happy evening to all. This is Thiruvannamalai is a holy place to me, not only because of Arunachala. This is my first place of government posting about 25 years back. We both joined together in the same institution at Jawad Hills of Thiruvannamalai. And second is, I became as professor, promoted as professor in the same college in 2019. Sir also has promoted in the same college as professor of physiology. And this is the first stage we are together for the third thing, that is the chairperson in a medical education conference. So this is my holy place. So I wish the organizing committee, the dean, and Sangeeta Madam, Vice Principal, and the Professor of Physiology, Dr. Priscilla, and the Soumya, and all the organizing members are very enthusiastic, and they did the job very nicely. And today we are here for the last session, that is teaching to think, introducing problem-based learning to undergraduate medical education, which is an important topic, which is going to be delivered by Dr. M. Niraimathi, MD DNB, PDCC, FAIMER, and Advanced Course in Medical Education. Madam is Associate Professor of Pathology, expertise in renal pathology. Now she is attached to JIPMER Karaikal. Madam has experience of total teaching experience and research experience of 12 years. Madam has 10 publications. Madam has conducted faculty development programs on problem-based, term-based learning, conflict of management, and artificial intelligence. And the dais is yours, madam. Over to you, madam. Thank you.
Thank you, ma'am, for the wonderful introduction. Thank you. At the outset, I would like to thank the organizing team for organizing a wonderful event. And a special thanks to Dr. Kripakaran, Dr. Anjana, and Dr. Priscilla for coordinating with me. And a quick thanks to the student volunteers too. So the previous two speakers have set the bar high. I think it's very hard for me to be in par with them, but I'll try my best. So today I think I'll just introduce you how problem-based learning can be implemented authentically and it has a different spectrum, and I would try to talk about that. Just to start with, just observe these two pictures, first and second, for a few seconds. I know one is large group and the other is a small group. And just to be active, I just want your input on what comes to your mind when you see the second picture. You want to see the picture again, or? The second picture, when compared to the first picture, what word comes to your mind? I know who has written this. Vinod. Okay, student activity. What learning environment, what emotions do you see in the second picture? Yeah, interaction, engagement, okay. They are engaged, they are listening. There is a group discussion that's happening. Okay. Peer mentoring, self-directed group discussion. I think SDG is that. Okay, so many of you are taught at the group discussion, and the curiosity they have and the learning environment they bring in are quite obvious when compared to the large classroom, right? So coming to the reality, so what we do, the conventional teaching learning, according to Bloom's taxonomy, we always stuck with the lower order thinking, right? It hardly we go and explore the higher order thinking skills in our day-to-day routine teaching learning methods. And when it comes to learning domains, most of us, we tend to concentrate more on the cognitive domain. And usually we don't talk much about the psychomotor and affective domain. And when it comes to integration, this is the hard and Slater of integration, you know. And again, whatever the integrated class we have or case-based learning we do, I think we can't go beyond kind of sharing or correlation, if I'm right? And the ideal higher end of the ladder, which is transdisciplinary, interdisciplinary, multidisciplinary, where discipline lines are blurred, is very difficult to reach in the conventional teaching learning methods. And this is always there where there is a gap between theory and practice. We teach them more, but we do only half of it in practice. And sometimes we do practice, but we not teach them. So there is always a gap in theory and practice. And this is like we like to spoon feed, and we still are obsessed with we being the information giver. And the world has changed, and now we are all learning about Gen Z, right? And they already have many sources of information. They have books, they have gadgets, they have internet platforms to give them a lot of information. And it's time for us to think what is our real role is as a teacher. And what our NMC tells us, what we have to train the students as to be the Indian medical graduate. And if you remember, in the 2023, they've added the additional roles from compared to 5, the new roles being the critical thinker and researcher. And if you closely observe, most of the skills are soft skills. And if you see the real scientific or cognitive part is very, very less, maybe the clinician part of it, and rest all are the soft skills. So we have a lot of issues, and I think it's time for us to think about this problem-based learning and whether it could cater to all these issues that I've mentioned about. So there are a lot of definitions. I will not go into details about it, but you can see the highlighted ones where they say that it challenges. Maybe we are not challenging the students enough, to stimulate the analytical thinking skills, or not. We are not creating them the actual environment they wanted us to provide. And the last one, where you can see that the principal idea behind PBL is the starting point of learning should be a problem query. We should actually challenge them with the problem and then see what the students are going to do with it. So this session, I would tell you about the core principles, process, and requirements of PBL, how to construct PBL problems, assessment, and actually PBL has a spectrum, and it's not a rigid component anymore. Okay, so coming to the principles, if you understand what is the logic behind the problem-based learning, and you would always know how it is different from the other teaching learning methods, we would have the scope to make some flexible changes to the authentic problem-based learning, which I'm going to tell you now. So there are 3 mantras, I would say, or 3 core principles. The first one being the problem, which always comes first. This is what you should think. Whenever you're going to give a problem-based learning, the thing is, it's always the problem that comes first, which means you're not starting with a lecture, you're not giving information, and then you're giving a case. You're starting with the problem. The main thing about this is you're going to structure the learning around this problem, which means the problem you're going to give acts as a stimulus for them to build learning around the problem. And why do we do this? There are reasons, because we could achieve certain objectives when we give problem first, so that it builds the knowledge around it. So the main thing is to build or structure the knowledge in the clinical context. So any problem-based learning should always have a clinical context, because it always integrates the clinical with the basic science. So it should always have a clinical context. And the next important one, which we are missing out in the traditional teaching learning or even the case-based learning, is the clinical reasoning process that you can, enhance once we give the problem as a first component. And the self-directed learning, today morning we had the first session with self-directed learning, where there should be an inquiry plan for the students. The problem can serve as that. It can trigger them to go to the path towards the self-directed learning. And then, of course, what we are lacking, what we are more worried about, is the Gen Zs are not motivated. So maybe this is a tool where we pose a challenge to them, and then they are motivated to learn from that problem. So the first mantra again is problem comes first. Always have this in the mind. And the second core principle is it's always a learner-centered, which means it's not only the group discussion. The students also take the ownership or responsibility to make a doable list of what they need to learn and what they do not know, and then have a plan. So that inquiry part comes with the learner-centeredness. And then the last one, the third core principle, problem-based learning, actually, they say, is an approach. It's not like a technique, like a case-based, it's a technique. So it's not like a technique, it's an approach. This part I'll come to the end of the session. You will understand why I told this. So there are three principles where problem comes first. It's a learner-centered technique, and it's an educational approach. And these are learning theories. I'm not going to talk about it, but there are whatever learning theories you know of, imagine them, and it all supports problem-based learning, be it and constructivism, adult learning theory, experiential learning, it all supports problem-based learning. So now, how do you do an authentic or ideal problem-based learning? So what are the requirements you should have? First, you should have a problem or in a text form, or you can have any other form, which I'll tell later. But the principal thing is you should have a problem. In PBL terminology, we call them trigger, because it triggers their learning. And the second is, of course, it should be a small group. And the ideal group is 6 to 8, but we can extend it to 10 or 12 based on our needs. And a facilitator would be ideal. So this is the ideal requirement for a problem-based learning. So how do you go about with the process? It's not like you make a fantastic problem and give to the students and the students will process it. It's not like that, because there are certain processes which we have to teach them, which we have to sensitize them so that they know about how to go with the problem. So there is something called Maastricht 7-step process, which I'll tell you. And the important part here in problem-based learning, when compared to the other teaching learning, is the process is as important as the content. It's not only the content which is important, but the process, how do they learn? How do they go about with the problem is itself is a learning process. That's why they say it's learning to learn. So that is an important thing in problem-based learning. And we have to sensitize the students that it is the discussion that is more important than arriving to a diagnosis. Because in any time we give them, they always take it as a quiz, because they are the MCQ generation, they have to solve the case. So we have to tell them the discussion is the part where you learn. It's not coming to a diagnosis. Sometimes I will give the diagnosis itself. This is the diagnosis, but the learning part is more important. So this we have to emphasize the facilitators and also the students. And the self-directed learning and collaborative. And this is one tool which actually encourages both self-directed learning and also collaborative learning, because people have to work in groups and also they should have an independent assignment which they should do. And the importance of the problem-based learning lies in generating the learning issues. This is what is called as learning objectives in our teacher's term. So what are the 7 steps? These are the very important steps which the students should be sensitized before giving a problem. So the first step is to clarify the difficult terms, defining the problem. Third is brainstorming, structuring an hypothesis, then formulating the learning objectives, self-directed learning, sharing and evaluation. So when they have a problem statement with them, they have to undergo these process, and they cannot finally suddenly give a learning objectives. They have to be as a facilitator, we should be able to monitor that whether they've defined, they are brainstormed it or not, whether they've created the hypothesis and then come to a learning objectives. So in practice, how do we do in my classrooms are like this. So it's an iterative process. It repeats itself. It's like a cycle. So when I give them the first trigger, they do all the steps of the Maastricht 7 step, like brainstorm, create hypothesis, and then they come to know what they don't know and what they know. So this is a very important step where we empower the students to identify their own learning gaps. So they read the problem, they know, what they don't know. So what they don't know becomes the learning issues. In our terms, it's called learning objectives. So that is very, very important steps. And that is the step we can actually, facilitators can come and check those learning objectives. And then after forming the learning issues, what they do, they assign certain topics to the group members. They have to learn themselves as a self-directed learning. So they assign, they research, they learn about their topics, and then they come back either in the same class or the next class to report and review what they have learned. So they organize whatever they've learned and they will share it. And then with the new knowledge, they see the problem which was already given to them. And then this cycle goes on with the second trigger and third trigger. And usually it takes 2 to 3 class. And this is the process they go through. So to encourage or to support the students, we usually give this template so that they fill these columns, like what are the patient information, what are the hypotheses they have known about that, and what they don't know becomes the learning issues. They have the doable list of what they have to read. And then we ask them what next you want, what investigations you want, or what next questions you have. And then we will answer them accordingly. So what are the roles in a small group? So this can be extrapolated to any small group activity. It need not be a PBL. For any small groups, you can assign certain roles to them so that the group functions on its own. So what we do, assign a leader or chair. Actually, they have to assign themselves, and they can take turns for each time of the small group activity. There should be a scribe who notes down, records, and then keeps time. And then comes the group members, whom we actually ask them to participate actively. They have to research and share. So any small groups for any matter, like whether it's PBO or a practical group, you can actually make them ownership by giving a leadership for a student to be a leader and another student to be a scribe, and then monitor them. So what are our roles then? If everything is done by the student, then what is our role? Do we have any role at all? Can you tell me a role or describe in short what defines a facilitator then compared to teacher? Because if you listen, I always use the word facilitator, not teachers. So we have to move from the role of teachers to be a facilitator. So what is the change? What is a facilitator? It's not like a teacher, then what is it? Guide. Okay.
Whenever they go wrong, they will correct.
Okay. So basically a coach kind of. Okay. Anything else? Okay. Take them to right direction. Two-directional communication. Okay. I mean, not directly in the sense, no direct communication. I'm not sure what does that means. Making them to think. Okay. Provide prompts. Yes. Yes. So when they ask question, what we do? We have to ask them questions again. Don't give them the answers. Any other thing? Make it a group dynamics. They should follow. Yeah. If some group is silent, then you have to motivate them. If some group is one or 2% will be dominant, they will be talking. So see to that the group. Because it curbs the clinical reasoning. Once we give them the answer, they don't think. So we have to know when to pause. and create a safe, clean, learning environment. If you are very strict and threatening to them, they will not share or they will not discuss properly. See to that the learning objectives are achieved. Ask appropriate questions. Somebody said, ask appropriate. It should be open-ended questions. It should not be very specific. Make them the right path. Somebody said prompts. We usually say prompts are guiding questions. We will keep them with ourselves. When the students are stuck, we will give them the prompts or the guiding questions. And the most important, tolerate the silence. Maybe sometimes they are stuck. You need not actually intervene. So it's like masterly inactivity, which the clinicians say, don't do anything, just tolerate for some time. And then again, the group discussion goes on. And as rightly ma'am said, monitor the group dynamics. And what we shouldn't do, it's more important. We should not act like a content expert. I'm a pathologist, they are making a mistake. I'll go and say, no, that is wrong. Your interpretation is wrong. Don't tell them like this. See carefully what is the interpretation. So don't give them the answer. And don't become an expert and don't give too much information. So you're not the lecturer here. You're not the content expert here. You're just a facilitator. So ask more questions and provide answer. This is very important. When to act and when to step back. So there will be some groups where they can act act good, and then the group dynamics are very good. You need not intervene at all. You can just stay back and just watch. There will be certain group which are stuck with certain things where you have to intervene, you have to step in. So you have to be trained enough to see that and then step in or step out whenever needed. So we have to move from the information provider to facilitator. Okay, so this is the common question that is asked. What is the difference? Can anybody tell me the difference between case-based and problem-based? Because this is a common question I keep on getting. What is the difference between case-based and a problem-based learning? Yeah. Okay, so in both cases will be there, but in problem, additional to the problems, you can give some other triggers also in form of videos or patients or anything. Wonderful, ma'am. Any other thing? Any other difference? Any other difference? So maybe I'll show you an analogy. This is what I thought and made a picture out of it. In my point of view, case-based learning is a package holiday and problem-based learning is an expedition. Can you just tell me like why so? So like a package holiday, I'm not saying package holiday is bad. It has its own comfort, but everything is set. The set itineraries, you know where to stop and where are the places you have to go. Everything is set and you know the time limits of it. Whereas the self-expedition is like a group of friends selecting the places and checking which will be good, which will not be good. And there can be some flexibility. If you're tired, you can stay back and go for the next. So there is some flexibility. So in other words, case-based learning is like a well-structured case scenario, and all the things which are needed about the case to diagnosis will be given. And your duty is to check whether you have understood it and whether you can apply it. So basically it checks the application knowledge, and it's a very well structured case scenario. Whereas problem-based learning is where it's very ill structured. You don't give all the information to the students. It's just like a clinician sitting in OPD and a patient is coming. They don't give you all the information. They give you certain information. You have a broad differential diagnosis, and then you think, okay, this may be the differential diagnosis, and then you give some investigations. And then patient comes back with the investigations. You don't know again what is the diagnosis. You just give some other investigations, and then you narrow down from your broad differential diagnosis. So at some point you have to take some decision. At some point the problem differential diagnosis changes, and then you come to certain diagnosis, and sometimes you're not even sure whether it's a diagnosis or not. So but this is the process we take them through in problem-based learning also. We give them ill-structured problems. Sometimes we intentionally don't give them the clues for diagnosis. We take them out so that they think and give a broad differential diagnosis, and then they think about what investigations they should ask for. And then when we give them the investigations, again, they will ask for some more investigations, and then finally they can come to a diagnosis, or sometimes there can be later learning also. So I hope I've clarified. And towards the end of lecture, I will be telling it's not even rigid like this. It's not like case-based is in one spectrum and the other is, there is always a spectrum and there is always an overlap. And I'll tell about it a little later. So how do you construct a problem in your department? If you have to start doing a problem-based learning at a department level or your class level, what all things you can do? These are some of my tips from what we used to do. So if you have a paper and pen, you can go along with me and you can keep writing. The first thing is choose a topic or a theme or a condition. So how do you choose in your discipline a topic or a theme? There are two criteria for it. It should be an important and relevant one because we have to put in a lot of efforts. We can't just teach them a rare syndrome and make it a problem-based learning. So it should be a very important and relevant topic. It should be complex and challenging. Why I'm saying this? Because you have a group which has to work on that problem, and it should be complex enough for not one person to solve it. It should have a collective discussion. It also should encourage self-directed learning. So it should be very complex enough. So then we can't use the simple problems which we come across to the day-to-day life. It's not so like that. You can make a simple problem into a complex one. A simple iron deficiency anemia. You can start with uterine bleeding and then go on with the iron deficiency anemia. Like, for example, if I'm going to give a problem on thalassemia major, I'll not give the direct symptoms and signs. I'll talk about secondary hemochromatosis, which is a complication of, thalassemia major, and then I'll bring it to thalassemia. So make it a simple one into complex. You just tweak it a little bit so that there is a complexity in it. So these are the two criteria. The topic should be very important and relevant. It should be complex enough should be a scope for group discussion and self-directed learning. So this is the first step. Second is choosing the integrating department. So problem-based learning is not complete without integration because it's one of the core thing in problem-based learning because you're going to blur the disciplines. It's always a patient-centered. So choose whatever topics you have choose the integrating department. It should be always one clinical, one basic science. That is for sure. And then you can choose rest of the departments. Yeah. So as I said, it's always a bridge between clinical and basic science. And it's always patient-centric. So whatever the problems you're going to design, you're going to write, it should always be around the patient. Yeah, so I'll move on. So second one. After choosing the topic, after selecting the integrating department, you have to sort out the learning objectives. You can divide this into content and process. As I said, problem-based learning is as equally it gives importance to the process as to the content. So have a content-oriented goals, have the process-oriented goals. Content-oriented goals can be cognitive, it could be psychomotor or affective or all together. And process-oriented, you can choose anyone. It could be critical thinking, effective communication, and interpersonal skills. Problem-based learning has the scope to include all these into the scenario. Then comes the design. How do you design? So we have all make case scenarios in our own disciplines. How do you make it like a problem-based scenario? So this is what you do. You have a catchy title there and you make a scenario in an active voice. You make it very realistic as if a patient is coming to you and they are having a conversation, or you make it like a story. And towards the lower down, you can see some guiding questions. So this is what we call as scaffolding. You may be wondering how a first year student or a second year student, third semester will understand this, where he or she will go and search for the learning resources. The initial part of it, we can support them. That is what is called scaffolding. So based on the level of the students, based on your expertise, you can have the learning resources with you. If the students needs, you can give them. These are the learning resources. If they don't know where to start with, you can have these guiding questions with you and then give it to them. Okay, so to have even more better clarity, how the design of the problem is within the spectrum. More complex it is and more unstructured it is, the better is the problem. And it also depends, as I said, the level of the students and their sensitization and the facilitators training all matters. So what I would suggest is go towards the scaffolding part initially and then slowly withdraw the scaffoldings. Once the students are trained, once you are comfortable, go for most of the ill-structured and open-ended little later. To start with, go with the structured one little bit. Okay, so as I said, the formats can be the story format. It is usually attractive to the students. So you give a name to the patient and you tell them what has happened, from where he or she is coming, and you make it like a patient coming to the OPD and what are the things you do. You can make it like that, or it could be like a conversation. The idea is to make it a realistic case scenario. This is the common format we follow in our institute. This is called as segmented progressive disclosure, which means you give the triggers in phases. Like I said, you don't give information altogether. You first give a trigger one, which usually has the clinical history, clinical details, and some part of examination and investigations, a basic level of investigations. And then the second trigger will have some other investigations which adds to the diagnosis. And finally, you give them the important diagnostic clues, investigations which leads to the diagnosis, so that they go through the path like a clinician with a broad differential diagnosis, and they learn the approach. And you give them the investigations only when they are asked. You tell them, you make the plan. If you ask for the investigation, then I'll give you. So we will make a fake patient's reports. And then when the students ask them, then we give them. And we ask them, what is the order and why do you plan for these investigations? And as ma'am said, the trigger material need not be always a text form. You can use audio, videos, even patients, lab reports, x-rays, and referral letters, even newspaper articles. So these are some of the trigger materials we usually give them. To summarize, your problem scenarios should be complex real-world situations. It should have relevance. We usually use the word hooks. When we create or when we design a problem or case scenario, we always look for hooks. That is which grabs students' attention. There should be some drama to it, no? Like a masala movie, like you make some elements, add to it, like make it like if a patient is diabetic, is not willing for amputation, so make a drama so that it grabs some attention. The students wanted to solve it, wanted to know about it. So you make certain hooks for each of your triggers. So these are some examples. You can incorporate as much as possible. You can incorporate the working conditions, socioeconomic background of the patient, the taboos and myths which you can incorporate. And even you can include ethical dilemmas. And actually, my FAIMER project is to include ADCOM into my problem-based learning. How do you actually give it both scientific and soft skills together so that students understand the holistic nature of the patient? So it becomes purely a patient-related case scenario or holistic learning for the students. Okay, so this is the next important part of it. When you design all these problems, you should also simultaneously create a PBL guide, because if I am creating or designing a problem, I will have certain goals and outcomes. If I'm sharing the same thing with the other facilitator, they need not have the same approach. So you share your learning outcomes, learning points as PBL guide. So these are the things we should have in a PBL guide. What is the theme? What is the intended learning outcome? What are the learning resources? You can give them the guiding questions. These the facilitator can have. If they need the scaffolding, they can give it to them. Otherwise, they can have it with them itself. Learning points. What are the other activities you wanted? So this is how you somewhat make the commonality between the groups. So now, how do you evaluate? You have designed a problem, you have implemented, but how do you know whether whatever you've designed is good enough, or whether whatever the principles are applied here, whether it triggers the clinical reasoning? How do you know it? There is a rubric for it, which I can share later on. So you can, when you are designing, you can itself self-evaluate whether it is fitting to all these criteria. You can also give it to your friends and then evaluate your PBL problems. So to summarize, you select a topic, integrate in departments, and then you sort out the learning outcomes, design the problem with the formats I told you. The progressive disclosure is the best format, and you make a PBL guide and then evaluate. I'll skip this. So first time when you design, you will not be very satisfied because it's a continuous process. If I take my problem scenarios which I've created like 3-4 years back, if I look, I will obviously make changes to it. So it's a continuous process. Just get feedback from students and then make a test run. And then at one point, I think you will be able to design a problem which is more satisfying. Then how do you assess? Any educational tool doesn't end with teaching learning, right? It has to follow the assessment. So again, you can assess for the content, you can assess for the process. Usually what we do is the concept map. We use concept maps. When we give the problem scenario, we tell them as a group, make a concept map so that we know how they've approached the case scenario. And then you can always have pre-test and post-test OSCE. And for the process assessment, you can have peer assessment, self-tutor assessment, and reflective writing. So for the past 2-3 years, we have been trying peer assessment. Actually, it is doing very good. Like a simple informal one, you give them the etiquette of how do you give feedback to the peers, what you should do, what you should not do. A simple sandwich technique, if you teach them and just ask them informally, say you have to give feedback to these 2, 3 students, and the next person should give feedback to these 2, 3 students, and they also have to give self feedback. So actually it works. So that gives them an accountability. Like if they will come up and say that actually I've not read in my hostel, next time I will do it. So they have that self reflection, and to some extent it works. And then always complete your problem-based learning with reflective writing. You can just collect it with the simple Google Forms. You can give the prompts and then collect it. They will respond, and the comments we received are very satisfying. These were some of the comments. Actually, we did FGD also to collect evidence of how it worked when we started initially, and it was all very positive. Okay, so can we implement problem-based learning in your college, in your department? Is it possible? Of course, there are a lot of challenges. I agree, because I'm coming from JIPMER Karaikal, where we have only 60 students. I have done extensively, mainly because we have small number of students. We could explore many techniques, and of course, you will have the constraint of manpower, time, motivation from the administrators, facilitators. Trainings are needed, and students should be sensitized for PBL. So all these I agree, but where do you start? So for that, I give a solution, because PBL has a spectrum. As I said, you need not stick to what I've told, the typical authentic problem-based. I will tell you about the spectrum of problem-based learning that is available. You can pick and choose. You know where you are at the stage as a facilitator. You can move one step ahead with the spectrum, which I'm going to tell. So traditionally, we usually tell any education strategies are as teacher-centered or student-centered, right? But we can also have some techniques which are, in between, where you initiate and students also contribute. There is always a in-between thing. And also, coming to case and problem, which I said, well-structured and ill-structured, you can also meet a middle ground where it's not totally very ill-structured so that the students are thrown away. You can make it starting with ill-structured and slowly move on to the structured one. So you can have a middle ground, and you can choose according to your expertise and according to your students' need. You can choose spectrum in between. So actually, there was a landmark article in 1986 itself, which gives about the taxonomy of problem-based learning, which says that you can have different combinations, and you can choose different methods. Say, for example, if you have the first one, lecture. Principle with the example, then it becomes rule and egg rule. So rule egg is first you give them the entire concepts and then give them the example. Egg rule is you give them the example and then tell them what are the concepts. So these are the two, again, broad spectrum, they say. This, in simple terms, you can understand like this. You have a cookbook, you and there, tweak little bit, and then you can move towards problem-based learning. So the same article tells, when you have to move towards problem-based learning, you are increasing the emphasis on the problem. The students are more challenged. There is activation of prior knowledge. There is discovery of learning, and learning is acquired in a meaningful context. Yeah, last slide for today. Which do you think you can do the problem-based approach in your classroom? Which one do you think? In lectures, you can make changes. In practicals, clinical postings, or integrated classes? These are the scopes where you can actually apply problem-based learning. All are drained out, I think. So my idea is to say that there are a lot of scopes for problem-based learning. So suppose Praveen sir was telling about self-directed learning has, right? So you can utilize that to give problems and then motivate them for self-directed learning. So clinical posting, okay? SDL has, it's even lectures also you can make. Okay, nobody's going to change their tutorials. Tutorials, we have a lot of has, and there is a lot of scope for small group activity. Okay. So nobody's touching the lectures and practicals now. Even we do for practicals, we have changed it. Initially, we have to, as I'm a pathologist, so we should show them the slides first. We will describe them and then ask them to see. They don't have interest at all. Now we give them the case. You find out the diagnosis. There is a slide which is placed there. You go and check, and then we will come and tell you. So that actually triggers them. They wanted to know what is the diagnosis. They will see. We will not tell them. At the end, they will wait for us. Then we will come and tell them this. This is what the findings are. We have even a TV monitor connected to it. We can show them at the end as a common platform. Yeah, so integrated classes, integrated classes because most of our integrated classes are actually team teaching. It is not integrated at all. Each one comes at one time and then takes the lecture. Yeah. Okay, so these are last few slides. So what are the future directions? This I actually adapted from one of the article here. So where do you start? You need not directly implement problem-based learning. You can actually nibble first. You can just start somewhere, right? You can try some aspects. It can be a small group activity. It can be a lecture where you introduce the problem first in a small way, and then enrich yourself, add some more components to it once you're okay with the first part. And then you can develop a problem-based learning module, and then you can extend. So this you can do both in your large classrooms and small classrooms. So hence, I propose that you can follow something called a hybrid problem-based approach in each of the classrooms, in each of the lectures or each of the practical classes. You can actually implement some part of problem-based approach. I'm not saying problem-based learning, you can have a problem-based approach because the main motivating factor is there is a clinical reasoning that happens, there is a clinical context where the knowledge is structured, and there is a part of self-directed learning and motivation that happens. Okay, so coming back to the first slide. So this is a large classroom. The ideal would be this with small group with a facilitator. If I can't do it, at least a simple classroom in between, I'll give some activity where they are in groups doing some activity or some small problems they solve. So you can even do it in a large classroom where you can convert the larger classrooms into smaller groups, and even one tutor is enough. We call them as a wandering tutor. They will go from one place to other and see how the group dynamics works. Not be the best one, but at least we can try in our own classrooms. So again, we have to move away from this. The ideal is to empower our students so that they function on themselves, function by themselves. If we can't reach, at least we can create the need. We can make them hungry a little bit. They also come and we also can feed. Somewhere in the middle, we can meet, I guess. So we need a lot of FDPs. We have to empower our students. These are my references. Thank you. This is my mail ID. You can contact me for any doubts. This is JIPMER Karaikal. You're all welcome. Previous lesson. Okay, these are the learning resources we want to take. These are certain books, e-books which are available. And actually, I've attended the PBL summer workshop from University of Delaware, which is very good. And there is a YouTube video conducted by JIPMER by St. John's. The YouTube video is available. You can actually go and check that out. And I would like to acknowledge my department. They were the pillar, because for each problem-based learning, there should be 4 facilitators. Only be 4 of them are there. They will come, even if it's 8 to 9, 9 to 10, 2 to 3. If there are 5 classes, 6 classes, all the facilitators will be there to monitor the small groups. I'm thankful to them. And thank you all for the patience listening. Thank you.
That was an excellent presentation, madam.
Thank you.
You beautifully highlighted the basics of the problem-based learning. Nowadays, the curriculum, actually, it is based for student-centered. It is not a teacher-centered.
Yes.
So this problem-based learning is we are going to use all the domains. The students will be utilizing all the domains, 3 domains mainly. And of course, the depth of the knowledge also will be assessed.
Yes.
You beautifully highlight jumps, the triggering factors, differences between the case-based and the problem-based, how to evaluate and how to assess all those things. It was really beautiful. I think it will be more informative and useful for all the facilitators who have been sitting here. Thank you, madam, for your excellent effort and presentation. Thank you.
Thank you.
Madam, this is a wonderful presentation. தமிழ்ல ஒரு சொல்லணும்னா ஒரு பழமொழி சொல்லணும்னா கட்டி கொடுக்குற சோறும் சொல்லி கொடுக்குற சொல்லும் எத்தனை நாளைக்குன்னு சொல்லுவாங்க. நீங்க ஃபர்ஸ்ட் ஸ்லைடும் லாஸ்ட் ஸ்லைடும் சொல்லும்போது இட் வாஸ் எக்ஸாக்ட்லி இன் டு மை மைண்ட். ஸோ தே ஹாவ் டு லேர்ன் டு குக் அண்ட் தே ஹாவ் டு லேர்ன் டு think and do the work. So one nutshell சொல்லணும்னா இது. Then it was an excellent and amazing presentation. I have 1 or 2 doubts. So this triggers how to so 1, 2, 3, you said many triggers. So it depends upon as all the for first year students, how many triggers it should have, like
okay.
for second phase and third phase. So minimum in first phase at least 2. In final phases you can have at most 5
Yeah,
to
ma'am.
6.
So thank you, ma'am, for the question. Actually, it depends on the time you have and the level of the students. If you have only one class also, you can do with 1 or 2 triggers. But the idea of giving multiple triggers is you have a time in between where they go back they learn, they do a self-directed learning, and then they come back and discuss. So that is the time we give them. Suppose we are doing it in one day, we have to sacrifice the self-directed learning part of it. But if you have only one day, or if you have to give a small problem, that is also fine. But to give multiple triggers, at least we have 3, because ma'am, the first trigger will usually have patient's details, examination findings, and basic investigations. And the second trigger, usually we have other investigations which are necessary. And the last part will have the final investigation part and treatment related issues. So it depends on the different phases. For example, surgery, they will concentrate more on treatment aspect of it. As a pathologist, we concentrate more on the pathogenesis aspect of it. As anatomy, we can concentrate more on the basic science. So it depends on the phases as well, and the integrating department, and of course the time which is available.
And the outcome, what we expect also.
Yes, ma'am. What are the learning goals? Learning goals.
Then regarding the assessment, madam, you said 7 steps in processing the PBL. So like in assessments also, you have to score like that in the 7 parts.
Okay.
Or
So,
So how
that
to
will be
assess?
very difficult to assess each step, but we can do one thing. When they show the learning issues, when they create, the facilitators will also have the learning outcomes, so we can match it. Suppose if it's not matching, we can actually direct them to prompt them to go in the right direction so that they create the learning issue. So we can have a check in that, ma'am. But assessment, that's why we have an overall assessment of peer assessment, tutor assessment, reflective writing, because the process cannot be assessed single point wise.
so it is more of subjective.
Yeah, ma'am. Yeah. So that's why we have
But still
concept
it
map.
is it is very important part in a adult learning.
Yes, ma'am. And that's why facilitators have to monitor how the group dynamics work, because they have to
So
see
we are
whether
no
all the
more
process
called
are
as
being-
teachers, we are facilitators.
Yes.
And assessment is more important than teaching.
Yes, ma'am. Yes.
So very nice and very nice presentation.
Thank you for the
Good luck,
questions,
madam.
ma'am.
Nice. Thank you.
Thank
you for the opportunity.
I really thank Dr. Priscilla Catherine, madam, for giving me the nice opportunity to share. I was a medical unit coordinator here. I think madam has taken this and she has very beautifully organized this conference. Really, my hearty congratulations to her and the entire team and the administrators. Thank you, ma'am.
Thank you. Thank you, ma'am, for sharing your expertise with us. Your insights into the topic were truly valuable, ma'am, and will guide us in our profession, ma'am.